Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Ami Dalal. Ami is a dermatology physician assistant, and thank you for joining me, Ami.
Hi, Janelle. I'm so excited to be here. Thank you.
Yes, welcome to the podcast.
Thanks. Exciting.
I always love having any physician assistants on just to be able to chat about, how you got into the industry. I feel like there's so many either medical assistants or biologic coordinators that are in school that are like, this is what I want to do, want to become a physician assistant. Or is it now physician associate?
I don't think it's official yet,
Okay.
but it depends
I've
on
been
the
hearing it.
state,
I'm
I
like, I
think.
don't know which one to
Yeah.
say.
Yeah. You could say physician assistant. That's fine. Yeah.
Yeah. But
Yeah.
yeah, I feel like it's grown so much.
It's grown a lot since I graduated in '05. Crazy. So yeah,
Yeah.
it's been a long time. People will be like, how do I get into school? I'm like, it's different now. It's probably a lot harder.
Yeah.
Yeah.
Do you think it makes a difference if you're already in dermatology? If that's where you're like, okay, I want to be in dermatology already and working in an office? Because I feel like a lot of times they leave to go to school because, that probably takes up a lot of your time.
A lot of my medical assistants currently want to be PAs, so
Mhm.
they're going back to school soon, so we're gonna lose
Yeah.
them, but yeah, I think it's
Oh,
great.
yeah.
Everyone should I love being a PA. I think it's a great profession. It comes up as a top 3, often
Really.
in the, US reports as
Mhm.
top 3 careers, so I agree with that 100%. Yeah.
Yeah. Were you always wanting to be in the healthcare space or in dermatology?
Yes, so I actually started and I did one of those tests in high school, right? And it said that I should do I was a dancer growing
Okay.
up. So it kinda said something more physical therapy.
Mm.
So I went for back then it was a straight physical therapy program, and one of the PTs actually that I was shadowing was like, "You're gonna hurt you're petite and you like to dance, you're gonna mess up your body. You should rethink this." And so
Really?
she actually made me rethink, and I just I did my bachelor's, and then I applied to PA school.
Mm.
So it shifted, and I actually started in bariatric surgery as a PA, so weight loss
Yeah.
surgery at
Wow.
Tufts and then Cornell in New York City, and then I knocked on Derm's doors and I got into Derm.
Yeah.
It was pretty amazing.
That's
Yeah.
exciting. What would you say now looking back that was never skincare or, dermatology, was that ever even a thought?
It was one of my so I got 2 offers, and one of them was dermatology position as a PA at Brigham and Women's in Boston, and the other one was bariatric surgery at Tufts, but they didn't have a full-time job, and I was, ready to work, you know? I was just getting out of
Uh-huh.
school, so I kinda went with the full-time offer.
Yeah.
But, after being in bariatrics for a while, as a PA, you're assisting in surgery, but you're not autonomous. And I think the coolest thing about being a PA in dermatology is that you're autonomous. You're making the decisions. You get to do procedures, you're hands-on. You get to do medical as well as cosmetic if you want. So, I get to use my artistic side, and I also get to use my medical side, right? So, I love it.
Yeah.
It's amazing. Yeah.
That's exciting. I think it
Yeah.
is dermatology is a fun field to be in, and it's just I feel like it's always changing and it's evolving so much.
Yeah, we're constantly learning, right? I love going to
Mhm.
the conferences and all the new things. We learn from the drug reps, we learn from the conferences, and
Yeah.
by using new drugs and from our peers,
Mhm.
it's pretty great. Yeah.
So, would you say that you're the friend that everyone texts about their skin before they go to an actual appointment?
Yes, absolutely. I get so many. You should see my text messages and my DMs, even from people I haven't spoken to in years. It's like, "Hey, here's a picture of a rash. What is this?" Yeah. Yes.
That is so funny. What's the most common thing that people say when they sit in your chair about skin?
I want to glow.
Mm.
Everybody wants to be glowy and flawless,
Yeah.
which doesn't exist, but, you know. Yeah.
What's the difference between glow and I always wondered this too, because everybody I do see that a lot, especially online where you're like, "Do you want that dewy look or that glowy skin?" And I'm like, "What exactly does that mean? Does that mean greasy or does
Yeah.
it mean
I mean,
does it
I
mean
think
like you're like, you when they say, "Oh, you've got that pregnancy glow," like, what exactly does that mean?
I think the glow is like hydrated skin. That's
Mhm.
what I would actually describe it as, but I think a lot of people, unless it's makeup, right?
Mhm.
But yeah. And then flawless, I think people are thinking like filters, like Instagram filters or TikTok filters or whatever
Right.
it is. But no one has perfect skin,
Yeah.
right? So
Yeah. I think
you
it's
want healthy skin, not
right.
perfect skin. Yeah.
Yes. Yes.
Yeah.
I think it's a difficult thing for people to understand, to a concept for people to grasp is, you know, what does perfect skin look like? Or they're
Yeah.
thinking that it is certain things with maybe what they're seeing on TV or online.
Their thing, it's the Photoshop stuff.
Mhm.
So it's really hard to convince people like, "Hey, you have, like, amazing skin. You don't
Right.
realize it." Yeah. So,
Well, so what is something that you really feel like is, I guess, maybe your specialty or what you really enjoy in dermatology?
well, I do love treating skin of color. I love treating acne, acne scarring, and I kinda love the cosmetics as well, so I like a lot of it.
Yeah.
Yeah.
The acne and acne scarring, I feel like is always a hot topic because a lot of people just look at it as cosmetic and it's so much deeper than just being cosmetic. There's so many pieces to it.
There are, because acne leads to acne scarring. So when people think acne scarring, they think I'm doing something cosmetic, but acne is it's a chronic condition, chronic medical skin disease. So, yeah.
How do you educate people, on taking care of their skin or when they come in and they're just, like, inflamed and, just are like, "I don't know what to do." How do you educate them on understanding their skin and getting better skincare habits?
I kind of have to ask a few questions first, like, what exactly are you doing at home? What are you using? I try to find out, like, what are they using? Are they washing their face twice a day, once a day? Are they using a moisturizer? It's really educating the patient on their skin barrier and protecting it. A lot of times, if you have inflammation or dryness, there's an issue with the skin barrier. So, a lot of times, you can help fix that with the product choice that they're picking. But with the acne, I kinda have to ask more like, are you doing whey protein supplements? Because for men, a lot of times that are trying to lift and, they're in the gym, a lot of them say yes. And they're
Mhm,
like, "I'm not gonna stop doing this." So I'm like, "Well, the acne is probably not gonna stop. If you notice that it started from that, then it may not stop. We can help treat it, but it's not gonna
mhm,
be fixed." Right?
right,
Or are you using products already? Are they over the counter products? Are they drying you out? Like, there's a lot of questions I have to ask to kind of get to the heart of what's causing the acne. Is it hormonal? Is it bacterial?
mm,
Right. Things
yeah.
like that.
So what is okay, I'm familiar with the hormonal. When it comes to bacterial, would that be just based on what somebody is putting on their skin?
It could be anything. There's bacteria that lives on our pillowcases. So if you're not changing your pillowcase out regularly or like at least flipping it and then changing it I say flip it after 2 to 3 days to my patients and then change it. If you have to put like another pillowcase underneath to keep it easy, do that. A lot of, younger kids are not going to change their pillowcases as much on their own unless their parent or someone's helping them do that. College kids have a hard time with that too, right? So things like that. Touching your face all the time during COVID, it was a big thing, like, oh, the masks were causing it was
Yeah.
maskne, right? So, yeah.
Mhm. Yeah, so if somebody is in the store, there's so many of these product lines where it's like, "Okay, do this skin test and you can, get your acne medicine." I forget what they're called. There's a couple different ones that I know. I've had some family members even trying it where they're like, "Oh, I'm gonna use this line because this is supposed to be good for your acne." What do you think about some of those product lines and just a lot of the over the counter? Do you think people really understand their skin well enough to make those choices, or is it possibly making it worse?
I was just gonna say that. I think most people don't understand their skin. I don't have a problem with the lines. I think the point of these acne regimens is to have a regimen, right? Like make sure you're washing your face twice a day, make sure you're using a moisturizer, make sure you're using a good active ingredient. But people themselves don't know. They're just throwing everything at it. They're like, oh, I saw this on TikTok. I'm going to use this. So it's like adapalene, benzoyl peroxide, salicylic acid. Then they use a wash with an acid. And it's like actually worsening it because it's making you more dry, more irritated. So I do think sometimes people need guidance. And I think it's basically like you kind of have to reassess. If you're using something over the counter or you're using one of these product lines, after 8 to 12 weeks, if you're not seeing a big change, you probably want to see a dermatology provider to see if you can get better advice on
Mhm.
your skin regimen
Right.
and like medical, prescriptions if you
Mhm.
need it.
Yeah.
Yeah.
Yeah, I feel like there's so many products that it can be difficult to
It's
even
very hard. Yeah.
mhm,
Yeah.
yeah, to navigate. So, rule of thumb would be if you said 8 weeks
8 to
and
12 weeks it takes to
yeah,
treat acne, to see a big change, and I tell all my patients that too. You gotta be patient.
mhm,
Stick with the regimen and be vigilant about the regimen.
yeah. So, when it comes to that deep cystic acne, is that more hormonal?
Yes, you got it. It is more hormonal, yeah. And that's harder to treat, like, superficially, right? It's just harder
Yeah,
because you can't just put topicals on there and expect that to get better.
mhm. So, how do you treat the hormonal big yeah, those are not fun.
No, and a lot of women are getting those, and the worst thing about that is the longer that sticks around, the worse the scarring is
Mm,
residually. But to answer your question, to treat it, if in females, I like to use spironolactone.
mm,
It controls female hormonal oil production in like a smaller dosage. In higher dosages, it controls blood pressure. So you have to be kind of careful with
oh,
some of the side effects. So I wouldn't just say like, "Hey, everybody needs to be on this." We talk through it.
mhm,
And then in men, we sometimes use doxycycline, so an antibiotic to control some of that inflammation. Sometimes you can do in office like intralesional Kenalog injections to drop the inflammation quicker.
mhm,
If there's a big one that's just not going away, you're like, I
yeah.
can't get rid of this. Yeah.
So, really, a lot of the medications that are like topicals are not really gonna do anything for that hormonal acne.
Not as much, but I never treat with I rarely, I shouldn't say never, treat monotherapy. Like you're only going to do this one thing and that's going to fix your acne. Hor- Like hormonal acne sometimes still has a bacterial component. Sometimes you can topically reduce some of the inflammation by using, an adapalene benzoyl peroxide combo or something like that. And that
Mhm,
actually helps with pigment too because if you can drop inflammation, you can prevent pigment from forming.
yeah,
So the quicker you do that, the better it is.
yeah. So, this is funny. We see those little acne pimple patches.
Yes. Yeah.
They tell me your thoughts on these because I have used some. I've used some that are like they're just like the clear ones and I'll have it on overnight, but I don't know what is going on with like everybody thinking that they just are wearing these stars and different shapes like all day long or isn't that just for over the overnight?
Yeah.
Yeah, it is
Yeah.
like a new thing. Everybody just wears them out like it's
I
decoration.
think it's kind of like a fad, right? It's like some of it. I think you could just as easily put like a topical prescription, like a piece, like the tiniest drop, and put it like a little layer on top of the acne cyst that you have, and it would go down also. So it's just like a more focused way of delivering that, I guess.
Mhm. But do you think that they work?
We don't really recommend them or not
No.
recommend them. Does that make sense?
Mhm. Yeah.
Yeah, it's like I kinda tell patients, like, if you wanna do that on top of the regimen I'm giving you and you actually feel like it's really helping you, go ahead, I don't wanna take that away from you, but you should be seeing improvement without those.
Right.
Right.
That makes sense.
Yeah. But again, you have to be patient.
Right.
So,
Yeah, and that's the
yeah.
hard part
It
because
is hard, yeah.
yeah, you want stuff to be clear the next
Like
day.
yesterday.
Right.
Yeah.
Yes.
Everyone wants instant gratification, especially nowadays. Yeah.
So, let's talk a little bit about acne scarring. Do you think people wait really long to treat their acne scarring, and what exactly do you do about that?
So, not everyone waits a long time, but I think people think they have to treat their acne and their acne has to be like 100% gone before they treat the scarring, which is not true. You can
Mhm,
do it in conjunction with your acne regimen treatment that we've given you or that you're doing yourself. Treating acne scarring, it does work. It's like successful. Your acne scarring can improve if you use the right treatment, but there are different types of scarring. So, I'll try to summarize this as quickly as I can. There's probably 4 main types of scarring. Post-inflammatory hyperpigmentation, which happens when you have inflammation, like that big cyst,
mhm,
and you'll get all the discoloration around there. So it's like a darker color that happened from the inflammation. Then there's indents, right? The indents, which we call atrophic scarring, which can also happen from the cyst being stuck there for a long time or injecting it, and you might get an indent there. Anything that's been there for a long time is most likely to scar or
mhm.
more likely to scar. And then just basic redness, like, the pimples that are more superficial that leave a little red mark, those are actually the quickest to go away. That just takes time. You don't have to do a lot to fix that usually. And then the last one is keloid scarring, which is more in skin of color. That's like, if you get the folliculitis for men and they shave and they have the ingrown hair and some people are just more prone to keloids.
Yeah.
So, treating those keloids, you could do intralesional catalog injections again, which
Mhm,
drops the inflammation, and like silicone sheets. Red scars, you just kind of leave alone, they'll go away if you
mm,
do your regular skincare routine and sunscreen. Post
mhm.
inflammatory hyperpigmentation, sunscreen is a must for like all of these actually.
Yeah.
Because basically, if you have scarring, like let's say there's a mark on my hand and I go out in the sun, that X is gonna get darker every time I go out in the sun, every time I'm driving, every time I'm sitting by a window. So, to protect it from getting darker, to allow it to fade, you have to protect it with sunscreen. And after 2 hours, it's like you're not wearing sunscreen. So,
Yeah.
gotta reapply. And then you could do chemical peels in the office, right? Just to exfoliate the top layer, get rid of that pigment. And then the indents, I really love microneedling for indents.
Mm.
It's like a pen with like 19 little needles. It stimulates
Yeah.
collagen over time. You need like 3 to 4 treatments.
Now, do you have to wait till your acne is completely gone before you can actually do microneedling?
No, people ask that. If your acne is really bad, I would wait to get it at least the 8 weeks to get it under control.
Mhm.
But after that, yeah, you can start it.
And that just stimulates the growth,
Yeah, if
to
you have an
heal?
indent, it's stimulating collagen and like those little needles are kind of stimulating the collagen by causing micro traumas to the skin, which then the skin's healing itself and it's filling the indent in slowly, if that makes
Yeah.
sense.
Yeah.
Yeah.
So, is it painful? I don't think
Well,
I've ever done it.
I numb people for like an hour. I'm like,
Okay.
I'll actually give people numbing cream if they say they're gonna do it. I'm like, take this home, put a thin layer on your skin, and while you're driving here, be numbing. You should be numbing like at least an hour before. So they're not sitting here like in the office just sitting around, right?
Yeah.
Like they don't have to bore themselves in the office. They can
Yeah.
do what they need to do at home and then come in numb.
So, how long does that take for to actually see results? How many times do you need to do it?
I would say at least 3 to 4 sessions,
Mm,
4 to 6 weeks apart.
okay.
But people see great improvement with their acne scarring with that.
Yeah. And that's
Yeah.
like, how long is one session?
Like the actual time to treat.
Mhm.
If you're only doing one little scar, it only takes 5 minutes. If you're doing the full face, probably like 10 to 15, not
Oh,
even.
wow.
It's a quick the numbing takes longer than the
Yeah.
treatment. Yeah.
I was getting ready to
Yeah.
say, I'm like, "Okay, so an hour of numbing for
Yeah.
15 minutes." Okay.
And that's just for your comfort. Like you could do
Yeah.
30 minutes of numbing, but I would do more. Yeah.
Mhm.
Yeah.
Right. I know, nobody wants to be in pain.
No.
And then the healing process. So is that like, say I'm gonna have microneedling done, I'm probably gonna be red and looking a little crazy for the next day or so, right?
Well, it's like you'll have like pinpoint bleeding like, initially, but I kinda, like I try to, like, clean you off and, like,
Mhm.
rub it in, and but you will be red, you'll be a little inflamed, and you'll be really dry because
Mm.
as your skin's healing itself, you get really dry. So
Yeah.
I always say don't use your active acne products during that time. Lots of moisturizer, lots of sunscreen. That's it.
Okay. I was gonna
Yeah.
say, I feel like at that point when you're putting stuff on, it'll just go right into your skin.
Yeah. Yeah, so a
You
lot
don't
of people.
wanna burn all the rest of the acne out.
Yes, exactly, exactly, yeah. And you don't wanna be more irritated because again, that can
Yeah.
lead to more pigment forming and more problems instead
Mhm.
of actually treating you. You
Yeah.
might get worse. So,
Yeah.
yeah.
So do you see a lot of people doing kinda like maybe Accutane and then are dealing with a lot of that scarring, so they decide to go with, some microneedling?
Yeah, actually, any type of acne patient, Accutane, and then just the people that are just on topicals or the people that are doing topicals and a pill together or just a pill even.
When it comes to Accutane, do you
Yeah.
think that it scares people because you've gotta do so many lab testing and, monitoring while you're on it? Because it's a pretty harsh medication to be on, right?
Yes, and actually my first attending that I worked with that took me in and taught me, like, all the cosmetics and everything, he actually didn't do Accutane because he had a couple patients commit suicide on it. So, like, I
Wow.
mean, it's crazy, like, I'm not saying that everybody does that, and I'm not saying that you shouldn't do Accutane, I'm just saying, like, people have a wide range of experiences with it.
Mhm.
So,
Yeah. So what does it actually do?
it's isotretinoin, so it's controlling all the oil production from the inside, basically, so that's why you get really, really dry on it,
Mm.
and you can't get pregnant on it, that's why women always have to do the pregnancy tests, and you're
Right.
right, there's a lot of blood work, like, every month you have to do blood work.
Mhm.
If people don't do it, then there's a delay in getting their medication, so it's a little bit more complex, like you said,
Mhm.
versus just doing the topicals or like a spironolactone in a topical or
Right.
a doxycycline in a topical.
Yeah. So
Yeah.
then while you're on this, it basically just kind of helps to close up the oil producing pores that cause acne?
Yes, and it works really well, so don't get me wrong, like, I know I said the thing about my first attending and that happened, and it did, but
Mhm.
you just gotta find the right patients for the right things,
Right.
and
Yeah.
that's why you have to come in to see a professional.
Yes, definitely.
Yeah.
So is it permanent? Because I've heard that people, do it and then they don't have acne again.
No, I
Oh.
see patients that come back and they're like, "I'm breaking out again," and
Mm.
I was on Accutane, but then, you don't always have to put them back on Accutane, you can it may be more mild, so you can
Mhm.
do, like, a topical and a pill, like, that's not Accutane.
Yeah.
So, yeah.
Okay. I feel like there's so many options.
There are a lot of options. Yeah.
Now, the insurance as far as, like, scarring, is that something that is more considered cosmetic? Insurance is like, "No, we don't cover it at all."
You got it. Yep.
Stop that.
Yeah. So, like, microneedling chemical peels are usually not covered by insurance.
Mhm.
Even
So
tretinoin is hard to get, like, basic
really? Yeah.
tretinoin topical gel, like, apparently now you have to be 21 or under to get it.
Oh,
Before it was 25 or 26 and under.
yeah.
Like,
Wow.
even if we write, like, "Patient has tried and failed.
Mhm.
This. They need this."
Interesting. They've changed
Yeah.
the age.
Yeah. I don't know why they did that, but
Yeah.
yeah, because every age breaks out. There's no
Mhm.
age to acne, but
Right.
that's a misperception that people have that only teenagers break out.
Mhm.
Yeah.
Oh, yeah. I know that.
Yeah. Actually, a lot of people that never broke out as teenagers break out in their 30s and 40s.
Mm.
Yeah.
Or they broke out when they were a teenager, and then they're still breaking
Still
out.
breaking out. Yeah, exactly. Yeah. Yeah.
I'm seeing that firsthand.
Your skin looks great.
Thank you. It's we got that glow going on right
You
now.
do. Yeah.
We'll see later on in a
Yeah.
week or so.
It does vary for women, right? Of course.
Right.
Yeah.
It's wild. The hormones it's no joke, I
Mm.
feel like that is it starts out with, okay, yes, as acne as a kid, but for me, I think it's probably always been hormonal issues. And I feel like that's kind of, around the time of the month or just different changes. But that's always for me, I feel like that's what it's been a struggle.
At
And it's
least you know kind of
oh,
what probably it's stemming from, though.
yeah.
Like, that's at least predictable. Like, hey, every like, this week of the month, I always break out.
Hmm.
Yeah.
Yeah, somewhat.
Yeah. It depends, I know, but still.
Yeah.
Yeah.
So, I know you said something about you were talking about, like, keloiding. I didn't realize that that was kind of a scarring. I was thinking that it's more like, when you get, like, a piercing or something, because 'cause I've seen that happen, like, keloids on the ear from it not healing. I don't know, I guess I never really associated keloiding with, like, acne scarring.
It's just the 4th type, so it's
Mhm.
like but it can happen on the ear, it can
Yeah.
happen on the body, it can happen with any type of trauma,
Mm.
and it doesn't have to be a crazy trauma, it can just be
Yeah.
that, like, "Hey, you had some inflammation here." It happens in certain types of some people are just more prone to
Mhm.
keloiding. So I
Yeah.
sometimes ask that, like, "Are you really prone to keloiding?"
And it happens because the body is trying to heal?
It's trying to heal itself, so it's protecting itself
Yeah.
almost,
So
but
then how do you get rid of a keloid? How do you remove it?
so
Or can you?
sometimes I don't like to cut it because it's another trauma.
Right.
I like to I try to inject it with, like, a diluted steroid
Mm,
solution, which is what we call intralesional Kenalog.
mm.
Um, and then I always tell people to use silicone sheets with any type of scarring. I think it helps a lot.
What are
Even
silicone sheets?
post-surgery. It's like, you know what silicone gel is? Like, where you
Mhm.
just apply it? It's
Yeah.
that, but it comes in a sheet, so you can just keep it stays on you. A
Oh,
gel will, like, wipe off. You put your clothes on, and if it's on your shoulder or something, it'll just wipe
yeah.
off. The sheet just keeps it it's like a little Band-Aid that has the silicone in it, so you just keep it on there, and
Okay.
it stays.
Yeah.
So it stays for longer.
Mm,
Sometimes I feel that that's more effective
yeah. So
and
it kinda
easier.
helps it to dissolve because it's what? That cells building up? I don't know, like, what is in there that's causing that skin to be? Because keloids are really thick.
The silicone sheet just helps in addition too, but usually if you just use that, it's not gonna go away.
Mm,
The injection is what helps drop that inflammation in there, and it
okay.
helps with the discoloration too because it can lighten it.
Mm,
So, it's
yeah,
not just one injection though, it's me
right.
you gotta keep coming in until it flattens out.
Oh,
Yeah.
okay. So it's not one
It's not
one
a one
fix.
and done. Yeah. Yeah, exactly.
How I mean, I feel like there's so much education around just acne and understanding how to treat the scarring, how to treat your acne, how to treat hyperpigmentation. What are some things that you do with patients because there's not enough time in an appointment to really
That
explain that
that's
and help
true.
them get on regimens and things.
I write it down. My
Mm.
handwriting's not great anymore. It used to be, but, when you're seeing so many patients a day, you're kinda just, like, writing, and my medical assistant's always like, should I rewrite this for them?" But, yeah, I usually write it down. I'm like, "What I think you should use this as a face wash." You know, ease yourself into it. If you overuse a retinoid at night, you're gonna get too dry, and you're gonna get worsening hyperpigmentation, especially in skin of color.
Right.
The second you have inflammation in skin of color, the melanocytes are they're having a party. They're, like, overstimulated. They want to go to that spot and make it
Mm.
darker. So, like, you
Right.
gotta control inflammation. Um, and then once you already have it, you have to treat it. So, sunscreen is the number one thing. It's like that example that I gave. If the scar was the X on my hand and it was always being exposed to the sun,
Mhm.
it would never get lighter. It
Yeah.
would just keep getting darker. So people don't realize, like, hey, I drove to work at 9 o'clock and then I left at 12 to go get lunch. But did you reapply your sunscreen? No.
Mhm.
Okay, so now treating your scarring is going to be harder.
Yeah.
Yeah,
It is hard too, I think, because usually how long is it before your sunscreen is you need to reapply?
2 hours.
2 hours.
Mhm.
So, like, remembering that and, especially if you're out and you're busy and you're, you know, doing whatever, going
It's a
about your
lot.
day. Yeah, it's
Yeah.
it's a lot to remember, but, maybe having making sure that you're able to do that, I think is very important. I forget too a lot of times.
Yeah.
You know what I actually forget? I was talking to somebody the other day, and we were just talking about, our hands and
Putting it on your
sunscreen on
hands.
the hands.
Yeah.
But I wash my hands so much, and so I'm like, "Okay, I need to remember making sure I'm reapplying," especially if you're in, like, car. Yeah.
That's the worst. But I actually got the UPF protective, like, gloves
Oh,
that have
yeah?
the fingers, so, like, I put those
Yeah.
on when I drive now.
That's a good idea. And
Yeah.
are they fingerless?
Yeah.
Yeah, I've seen those.
Yeah, you can get them on Amazon. Like,
I'll
just
have to look
yeah.
at that.
Keep them in your console in the car. Yeah.
Yeah.
I actually keep that in a powder sunscreen
Oh,
so I
okay.
can reapply on my ears, my neck, my
Yeah.
hands before I start driving. Yeah.
And so do you think the powder sunscreens work just as good as the liquid or the lotions?
Well, I tell everyone apply your sunscreen in the morning first, like
Mhm.
the lotion first. But for
Yeah,
reapplication, it's better than not reapplying at all, right?
yeah.
So it's if it's easy to keep with you, that's a good thing.
Mhm.
Keep it in your purse, when you're traveling, when you're
Yeah.
driving, just in between
Mhm.
things.
Yeah, because especially I like that idea, especially if you put that on first and then you're putting foundation on and, nobody wants to go back and put more sunscreen over
Right.
their face after they've
Yeah.
already done their makeup. So, yeah, a powder option is a really good idea.
Yeah, it is. Yeah. And I also say like tinted sunscreen provides a little more protection than regular sunscreen.
Mm, yeah. I
So
didn't know
it's
that.
just about finding something that you feel like goes with your skin tone.
Mhm.
That's the hard
Right.
part. But
Yes.
there's more and more sunscreen tones now out there.
Yeah.
Yeah. So,
I think there are too, especially, for some of the darker skin tones. I think, that's something that I've always looked at, especially for my daughter, trying to find something that's not gonna leave, like, that purplish tint
or
or
like a white
a white cast.
cast.
Yes.
Yeah. That's always what people used to ask me. They're like, "Well, how do I prevent the white cast?" I'm like, "You're probably using the wrong product. Like, let's
Mhm.
find you something that works." You
Yeah,
know?
absolutely. I know, 'cause that'll deter her from wanting to put any on,
Of
'cause
course, because you're like, "I look
people.
ridiculous. Like, look at
Mhm.
this white cast on my face." Yeah.
Right.
Yeah.
Yes. So you do a lot of cosmetic procedures. What are some of the things that patients are looking for or asking for right now?
I think the cosmetic landscape is shifting a little bit, the aesthetics landscape. It's I think 5 or 6 years ago, people were like, "Oh, if it moves, freeze it. If there's a line, fill it," right? Like, take care of that one problem. Don't look at the patient as a whole. I think now people are saying, "Give me something natural, more subtle. Like,
Mm,
give me facial balancing, work on my texture, my glow," right? Like,
yeah.
yeah, it's more holistic. Like, people are not just treating their face, they're treating their neck, their hands, their
Yeah.
hair, like everything now.
Yeah.
So, I think biostimulatory, like, fillers, like Sculptra are
Mm,
really popular right now because it just helps stimulate collagen over time. Some, like, other procedures like soft wave, it's like the newer version of therapy
mhm.
to, like, stimulate collagen, tighten the skin. Those are
Yeah.
more common now because it treats the lower face and neck.
Yeah.
I think Botox has always just been there, and it's a great alternative to, like,
Mhm.
if you're scared to do anything else, at least it wears off in 3 to 4 months.
Right. Yes.
You can't, like and you can go slow with it. You don't have to do everything. You can
Mhm.
just do a small area and see how you feel, and then take
Yeah.
it from there.
Yeah.
Yeah.
Have you seen I've been seeing these on social media. They're called frownies. They're
I
supposed
have,
to
like,
be
those,
like.
like, stick-ons,
Yeah.
right? Yeah.
Do they work?
I mean, I can't say they really work, but I'm sure they, like, keep you from waking up with, like, a more significant line
Yeah.
initially
Yeah. I'm like,
because it's
I
keeping
still
you
like,
from
a lift in my brows if I'm getting
Yeah.
Botox. I wanna feel like I've had something done, but I don't wanna, look like I can't frown. Like,
You
"This is
want,
me
like
mad," and I'm still.
Yeah. I think the thing I always talk about with patients is you wanna look refreshed.
Mhm.
That's it. You don't want people to know that you did anything crazy, but you just wanna look a little more like well rested,
Right.
right? That's it.
Have you
So,
ever had to talk anybody out of doing too much, like
yes,
overdoing it?
100%. I've had patients come in and I'm like, there's nowhere else for me to fill your face. And I'm not putting my name on that. So I'm not going to do it.
Right.
You know, like, unless you're willing to dissolve and start again, we're not doing this.
Mhm.
Yeah.
I always wonder what that conversation is like because I feel like it would be difficult if they've got, an idea of what they think that they should look like or maybe even a not so healthy outlook.
Yeah, it's like a slippery slope. It's like people
Mhm.
that constantly get plastic surgery and can't, like, see themselves and, like, what they're doing to themselves, right?
Yeah.
So, I've been lucky. My patients that have wanted more have been my patients for a while, so I'll be like,
Mhm.
"Hmm, I don't think we should do that." And
Yeah.
then they listen. Or I'll be like, "Let's just do a little bit and go slow. Like, let's
Mhm.
see how you do. Like, if you still want this in 5 months when it's maybe, like, you know, dissolved a little bit on its own,
Right.
we can see. But I don't think we should do it today."
Yeah.
So,
Absolutely.
yeah.
That's good. They build that confidence and trust in you to be able to, ta like your opinion and accept that too.
Yeah,
Very
I think that's what it's all about, right? Especially with cosmetics, you want people that trust you and
right.
trust your opinion. So you don't wanna overdo someone because then they're walking around and they're like, "Who did you go to?" Right? So,
Yeah.
yeah.
What would you say for people that are looking what questions should they ask their provider to know, is this the right person to do my Botox? Are they gonna just inject because whatever I'm saying goes, or are they gonna actually think about how it's gonna affect me later or what it's gonna look like, to be able to give that feedback?
I think you have to do your research just like with everything else, right? Who are you seeing? How long have they been doing this? Patient testimonials. You can ask the provider themselves, but
Mhm.
I think you have to do the research beforehand a little bit. Maybe it's a friend of yours that went to see them and they really liked them. That
Yeah,
happens to me a lot. People be like, "Oh, I referred my friend to you because I really like you and I like the results." So,
right.
that's always a nice compliment. Yeah.
Yeah, for sure.
Yeah.
What do you think is the best thing about your job?
I think that people come back and they're so happy.
Mhm.
I think it would be really hard to work in, like, oncology or something like that, right? Like, I think
Yeah.
we get to see patients and they have improvement. Every time I see an acne patient, usually they're saying, "I'm getting better,"
Mhm.
and they're really happy. I had a patient last week and she was just like, "I could just hug you." You know? She was so happy, and I love that. I love seeing people that are really happy with their treatment plan, right?
Yeah.
So, whether it's acne, psoriasis, eczema, like, aesthetics, it doesn't matter.
Mhm.
Yeah.
Yeah, it makes a difference. I love that it's improving quality of life for people. Now, I love that we've kind of moved from that almost that plastic look to
Yes.
everybody is very much more confident and interested in their skin health as a whole and what they're putting in their body and how they look. Yes, we do have a lot of influence with social media, but at the same time, that overall idea of wanting to look healthy and to feel healthy and have that more natural look, I think is a good trend to have.
It is, it's really nice. Yeah. I like it better because I think I tend to be a little more conservative with treatments. I try to go slow with people so that they don't feel overwhelmed and they still look like themselves.
Yeah, absolutely. What would you say that to someone who's struggling with their skin and their confidence right now?
I would say, keep it simple. Like, if you feel like you're overwhelmed or you're struggling, keep your routine really simple and come see, you know, someone, a dermatology provider. They can help you. Don't try to do it on your own because you don't need to do it on your own.
Mhm.
That's why we're here. So come see us. Yeah.
Yeah,
We can figure it out together. Why are you having this problem? Why are you inflamed? Why are you having acne?
yeah, I think so. I think that's good. It's just really knowing who to reach out to and, knowing that there is support available.
Yeah.
It makes a huge difference. So, what is new? What are some things that you're looking forward to coming up in the future, and yeah, how can people find you and then learn more?
Hmm. Well, you can find me on my Instagram. It's aesthetics by Ami, and then the under it's not an is it underscore?
Yeah.
The little line at D and then another underscore.
Okay.
It's complicated, I guess, but
We'll put it in the show notes so
yeah,
people can find
yeah,
you.
yeah. But I work in New Jersey currently, but I'm like a New York and New Jersey dermatology provider, and um, yeah, that's how you can find me. What am I looking forward to that's new? I feel like I kinda like, it's all the same stuff I kinda mentioned already, the biostimulatory fillers, the soft wave, the things we already have that actually work really well that aren't broken, right? Like microneedling and chemical peels. Like, it just really depends on what you're treating.
Yeah.
So,
Okay.
but yeah.
Yeah. Well, thank you so much, Ami. It's been such a pleasure having you on. I think there's so much good information, and really, I think helping people understand acne, be able to, I mean, because you wear it right on your face, right?
Yeah.
And being able to have that confidence and knowing, who to reach out to, I think is so important. But knowing what actually works, I think that is the biggest takeaway is understanding, to go see a professional.
Yeah.
You're conscious of where you're getting your information. I think that's the biggest thing. So,
Especially with all the influencers out there now
yeah.
that are like, this is the greatest thing, but maybe it's
Right.
not the greatest thing for you. So,
Right, exactly.
yeah.
Well, thank you so much for joining me. It's been so great talking to you.
Thanks for having me.
Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.